Good evening, Berkeley, and thank you for joining me for my twice-a-week update on the City of Berkeley's efforts around COVID-19. And I want to start out like I have in every single one of my updates to thank our city staff, including our first responders, that are working to keep our community safe and provide essential city services. I want to thank the frontline medical staff that are putting themselves at risk, including our nurses and doctors who are working in our hospitals and clinics, to provide care to the sick and comfort for the families affected by this virus. Thank you to all of you who have supported our frontline medical workers through donations of meals and personal protective equipment. And lastly, I want to thank the Berkeley community. It's been over 6 weeks since the shelter-in-place order was put in place. I know it's been challenging, not just for our residents, but our businesses. But please know that staying at home has helped save lives. We are working to flatten the curve. And I'm just amazed by the incredible support that we have shown for each other and the most vulnerable during this time. From the Berkeley Mutual Aid Network to your support of the Berkeley Relief Fund, we are truly stronger together. So thank you, Berkeley. I'd like to provide an update on the number of cases of Berkeley residents who have contracted COVID-19. As of this morning, there are 51 lab-confirmed cases of Berkeley residents who are COVID-19 positive. And we learned several weeks ago that sadly one Berkeley resident has died due to complications related to COVID-19. Of the over 1,000 tests that have been conducted on Berkeley residents, 5% have been positive. We learned this morning that health officials in 6 counties and our Berkeley health officer have issued an extension of the shelter-in-place order that was originally put in effect in mid-March. That order will take effect at midnight this Monday, May 4th, and will extend to the end of May. And I want to provide an update on some of the eased restrictions as well as what restrictions are still in place. While the health officers have eased some restrictions on certain business activity, we still must shelter at home. Unless you are leaving for essential business or to get exercise, you are still asked to stay at home. And this is incredibly important to help reduce the spread of the virus and to help flatten the curve, to ensure hospitals are able to deal with the number of patients, and also to keep our community safe. And please know that sheltering at home and staying at home is saving lives. Just an update on some of the business activity that is now allowed. All construction projects are allowed to resume as long as they comply with safety protocols that were included with the order. All real estate transactions will also be able to resume, but with continued restrictions on any open houses and limitations on in-person visits. Certain outdoor businesses can also begin operating again, including wholesale and retail nurseries, landscapers, gardeners, and other businesses that primarily provide outdoor services. And outdoor businesses do not include restaurants, cafes, or bars, regardless of whether they have outdoor seating. We know that restaurants are still able to operate in cafes, but under very specific restrictions and only for takeout or delivery business. Other activities that can resume under the new order include residential moves. I know we've gotten a lot of questions around that. And use of certain shared outdoor recreational facilities that were previously closed, like skate parks and athletic fields. And I know our Parks Department is looking at how to open up our skate parks and other athletic fields and recreational facilities while also still ensuring physical distancing to keep our residents safe. We cannot move too quickly in lifting the shelter-in-place restrictions, and I know it's been difficult for our residents and businesses, but by putting these restrictions in place, we are working to reduce the spread of this virus. And lifting the restrictions too quickly will undo all the progress that we have made to fight this deadly virus and subject ourselves and our neighbors to contracting COVID-19. Our decisions on easing restrictions must be based on modeling of hospitalizations and infections, on access to testing, expanded contact tracing, and making sure that we have the staffing and the testing equipment to adequately test and track the spread of the virus. So our decisions must be based on science and the data to track and limit spread. We know on Tuesday, Governor Newsom announced a 4-phase plan to lift the statewide shelter-in-place order. And our health officers also release indicators that will be used to measure progress and also look at how to ease some of those restrictions going forward. Please visit the City of Berkeley's website, cityofberkeley.info/coronavirus, for a copy of the full shelter-in-place order that was issued today, and as well information on the indicators that the regional health officers had issued. And lastly, please join me and City Manager D. Williams Ridley, our Planning Director Timothy Burrows, and our City of Berkeley Health Officer Dr. Lisa Hernandez for a virtual town hall where we will address the recent shelter-in-place order and provide updates on the city's response to COVID-19 and answer your questions. So our town hall will take place this Saturday, May 2nd at 12 p.m. You can watch it live at jesseadegein.com or by going to the Mayor Jesse Adegein, all one word, Mayor Jesse Adegein, YouTube page or Facebook page. And you can ask your questions before 9 a.m. Saturday morning by accessing a link on my website, jesseadegein.com. We welcome your questions. We look forward to updating you on this recent order and the work the City of Berkeley has been doing to fight this virus. So in closing, please stay home to save lives. When you leave the house, please practice physical distancing of at least 6 feet from others. Please wear a face covering, and please do what you can to support yourself, your family, and your neighbors and community during this difficult time. Please be safe, and I will see you this Saturday at our virtual town hall. Thank you, Berkeley, and good night.